Hey everyone, and welcome back to the channel. Today, we're tackling a super important topic that could save you thousands of dollars and a whole lot of headaches. We're talking about Medicare. Specifically, we're going to dive into the 7 biggest Medicare mistakes that seniors need to avoid in 2026. Now, I know what you might be thinking. Medicare can feel like a giant, confusing puzzle. With all the different parts, plans, and deadlines, it's easy to feel overwhelmed and even easier to make a costly error. In fact, some of these mistakes can have financial consequences that last for the rest of your life. That's not an exaggeration. Missing a key enrollment period or picking the wrong plan based on incomplete information can lead to lifelong penalties and gaps in your healthcare coverage when you need it most. But don't worry, that's exactly why I made this video. My goal is to break it all down for you in a simple, easy-to-understand way. We're going to walk through each of these 7 common pitfalls, step by step. We'll cover everything from the infamous late enrollment penalties to the misunderstandings about what original Medicare actually covers, and why simply sticking with your current plan year after year without a review could be a huge financial mistake. By the end of this video, you'll be armed with the knowledge you need to navigate your Medicare journey with confidence. You'll know exactly what to look out for and how to make the best choices for your health and your wallet in 2026 and beyond. So grab a notebook, get comfortable, and let's get started on avoiding these crucial Medicare mistakes together. Mistake number 1, enrolling in Medicare late and paying lifetime penalties. This is the most expensive and one of the most common mistakes seniors make. Medicare has very strict enrollment periods. If you miss your initial enrollment period, the 7 months around your 65th birthday, you will pay a permanent penalty for the rest of your life. In 2026, the Part B late enrollment penalty is 10% for every full 12-month period you were eligible but didn't enroll. That means if you wait 2 full years, your monthly Part B premium will be 20% higher forever. Real numbers for 2026, the standard Part B premium is $202.90 per month. With a 20% penalty, you will pay $243.48 every single month instead. Over 15 years, that adds up to more than $7,300 in extra costs, just for Part B, and this penalty never goes away, even if you later qualify for financial help. Why do people make this mistake? Many think I still have employer coverage, or I feel healthy. I'll sign up later, but even if you have group health insurance through work, you usually still need to enroll in Medicare at the right time to avoid penalties. How to avoid it? Mark your calendar 3 months before you turn 65. Go to Medicare.gov and use the Plan Finder tool. If you have creditable employer coverage, you can get a special enrollment period later without penalty, but you must have official proof from your employer. Source: Medicare.gov, Medicare Late Enrollment Penalties, updated February 2026. Mistake number 2, thinking that original Medicare covers everything you need. This is a very common misunderstanding. Original Medicare, Part A and Part B, does not cover routine dental care, vision exams and glasses, hearing aids, dentures, or long-term custodial care in a nursing home. In 2026, the average cost of a full set of dentures is $2,800 to $4,500. A good pair of hearing aids costs $4,000 to $7,000. Routine eye exams and new glasses are paid entirely out of pocket. Many seniors are shocked when they receive these bills. How to avoid it? You have 3 main options in 2026. Buy a Medigap plan plus separate dental, vision, and hearing coverage. Choose a Medicare Advantage plan that includes dental, vision, and hearing. Most plans do in 2026. Pay out of pocket or use discount programs. The smartest approach for most people is to compare plans every year during the annual enrollment period from October 15 to December 7th. Source: Medicare.gov. What Medicare doesn't cover, 2026 edition. Mistake number 3, choosing the wrong Part D prescription drug plan or having no Part D coverage at all. In 2026, the average monthly premium for a standalone Part D plan is around $58, but many excellent plans are available for $0 premium in certain areas. However, choosing the wrong plan can easily cost you thousands of dollars in higher copays and deductibles. The 2026 Part D deductible can be as high as $590, and after that, you typically pay 25% of drug costs until you reach the $2,100 out-of-pocket maximum. For seniors taking expensive medications, The wrong plan can add $3,000 to $6,000 extra per year. How to avoid it? Every year between October 15th and December 7th, use the Medicare Plan Finder at medicare.gov. Enter your exact medications and zip code. The tool will show you which plan saves you the most money. Never just renew your old plan automatically. Prices and covered drugs change every year. Source: CMS.gov 2026 Part D Landscape and Medicare.gov Plan Finder. Mistake number 4. Not understanding the real difference between Medicare Advantage and Medigap. Medicare Advantage, Part C, is an all-in-one alternative offered by private companies. These plans often include extra benefits like dental, vision, hearing, and gym memberships, and many have $0 monthly premiums. However, most have provider networks and may require prior authorization for services. Medigap, Medicare Supplement, works with Original Medicare. It has no networks. You can see any doctor or hospital in the US that accepts Medicare. But it usually does not cover dental, vision, or hearing. Many seniors choose Medicare Advantage because the premium looks lower, then later discover their favorite doctors are not in the network or care is denied. How to avoid it? Ask yourself these 3 important questions before choosing. Do I want to keep seeing my current doctors? Do I travel frequently? Do I take expensive medications? If you answered yes to any of these, a Medigap plan plus Part D is often the better choice. If you want low or zero premium and extra benefits, Medicare Advantage may be better. Always compare both options every year. Source: Medicare.gov. Medicare Advantage versus Medigap Comparison Guide 2026. Mistake number 5. Not understanding Medicare Advantage networks and prior authorization rules. In 2026, over 54% of Medicare beneficiaries are enrolled in Medicare Advantage plans. These plans often look attractive because they have $0 premiums and include dental and vision. But almost all of them use networks, HMO or PPO. If you go to a doctor or hospital outside the network, you could pay 100% of the cost yourself. Many seniors are shocked when they receive a $15,000 hospital bill because they didn't check if the specialist was in network. Additionally, most Medicare Advantage plans require prior authorization for surgeries, MRIs, specialist visits, and even certain medications. If you don't get approval first, the plan can deny the claim completely. How to avoid it? Before you enroll, call every doctor and hospital you currently use and ask, will you accept this specific Medicare Advantage plan in 2026? Write down the answers. Use Medicare's Plan Finder tool and look at the provider directory for each plan. Choose a PPO plan if you want more flexibility, even if the premium is a little higher. Always keep a current list of your doctors and update it every year during the annual enrollment period. Source: Medicare.gov. Medicare Advantage Plans Guide and 2026 Network Requirements. Mistake number 6. Forgetting or skipping the annual enrollment period and never comparing plans. From October 15th to December 7th every year you can switch Medicare Advantage plans or change your Part D drug plan. Many seniors simply renew the same plan year after year without checking. In 2026, premiums, deductibles, and covered drugs change for almost every plan. People who stay with the same plan without comparing often pay $802,500 more per year than they need to. How to avoid it? Mark your calendar right now, October 15th to December 7th, 2026. Set a reminder on your phone. During that period, go to Medicare.gov and compare all available plans in your zip code using your current medications and doctors. It takes about 30 to 45 minutes and can save you thousands. Even if you are happy with your current plan, look at the new star ratings. Anything below 4 stars is worth considering replacing. Source: CMS.gov 2026 Medicare Advantage and Part D Landscape Data. Mistake number 7. Not applying for extra help, low-income subsidy, even if you qualify. In 2026, more than 13 million Medicare beneficiaries qualify for extra help but are not receiving it. If your annual income is under about $23,000 for an individual or $31,000 for a couple, and limited assets, you can get your Part D premium, deductible, and copays reduced dramatically, often to $0. Many seniors think I'm not poor enough or don't want to apply because of pride. But this program is specifically designed for middle-class seniors on fixed incomes. How to avoid it? Go to SSA.gov or Medicare.gov and apply for extra help. The application is simple and takes about 10 minutes. You can also call 1-800-Medicare or visit your local SHIP counselor for free help. If approved, you can change your Part D plan any time of the year, not just during enrollment. Source: SSA.gov Extra Help Program, 2026 Income and Resource Limits. Let's quickly recap the 7 biggest Medicare mistakes in 2026. 1. Enrolling late and paying lifetime penalties. 2. Thinking original Medicare covers everything. 3. Choosing the wrong Part D drug plan. 4. Not understanding Medicare Advantage versus Medigap. 5. Ignoring networks and prior authorization. 6. Skipping the annual enrollment period. 7. Not applying for extra help if you qualify. Avoiding even one of these mistakes can save you thousands of dollars every single year. Remember, this video is for education only. It is not advice. Please consult a licensed Medicare advisor or SHIP counselor for your personal situation. All information is based on official Medicare.gov and CMS.gov data as of February 2026. If you found this helpful, please give it a thumbs up, subscribe to Senior Finance Guide, and turn on notifications so you don't miss our next video. In the next one, we'll cover the biggest retirement tax mistakes in 2026. Thank you for watching. Stay informed, stay protected, and we'll see you in the next video. Take care.